morning.
Good morning.
Thank everybody for attending. And I want to thank Kathleen Falk and Kurt Shipley for being here. They're going to share with us some information on the open enrollment for the Affordable Care Act, the ACA, or Obamacare as it's known. Kurt is an outreach specialist from Aspen, and he's going to provide us with some information on where you can go in Kokomo to get enrolled. Kathleen is the Region 5 Director for the U.S. Department of Health and Human Services. She's going to give us information on the ACA enrollment times and the new and simpler application. Again, thank you both for stopping in to Kokomo to help inform our people about the second enrollment period. One of the most important aspects of maintaining our health is staying informed about insurance options. One of Mayor Greg Goodnight's duties is to ensure that our residents are safe, prosperous, and healthy. Keeping them informed is part of that responsibility. Maintaining our health is an important part of having a vibrant and happy community. One of the things that we can individually do is to ask our family, friends, and neighbors, are you covered? February 15th is the last day to sign up during the enrollment period. That's the day after Valentine's Day, and I can't think of a better way to express your love for someone than to make sure they are covered and informed about their health. The City of Kokomo is happy to do whatever we can to ensure that our residents are informed about their choices. We want you to be able to make the best choices for your families and budgets. I believe that informed citizens are going to be healthier citizens, and good health improves our quality of life. Now I'll turn it over to Kurt, and Kathleen's going to follow up and close. And thanks again, everybody, for being here today. Thank you. Kurt.
Director Falk, everyone else. As I was introduced, my name is Kurt Shipley. I'm a Navigator and Central Region Supervisor for Aspen's Navigator program. Aspen stands for Affiliated Service Providers of Indiana and is a network of community mental health centers, which has grown to include 5 service lines and the Specialized Navigator program. In connection with some of the information that Director Falk will be speaking on, I'd like to add some program-specific perspective to this discussion. Through the end of last week, Aspen's Navigator program has been able to attend almost 800 outreach events. At these events, we've connected with nearly 50,000 consumers, and we have conducted over 3,000 enrollment appointments. As we head toward the end of open enrollment, we currently have 78 events scheduled across the state. 18 are here in the Central Region and include local opportunities in Kokomo, Lafayette, Logansport, Marion, and Wabash. These results and the work we're continuing to do would have been much more difficult without the connections we've made with community partners. Our program's collaborations with community mental health centers, such as locally Community Behavioral Health, Ivy Tech Community College, Indiana's Minority Health Coalition and Rural Health Association, Area Health Education Centers, the Small Business Administration, and the Indiana National Guard have allowed us to connect with populations of Hoosiers that often experience the greatest health disparities. Many of us here today have witnessed firsthand the difficulties faced by those experiencing poor health, which affects people not only physically, but also financially and psychologically. One of the greatest joys of being a navigator is successfully assisting individuals and families in accessing quality and affordable health care. Despite all the positives we've seen, there is still much work to be done in assisting more Hoosiers in their efforts to affordably achieve and/or maintain good health. To that end, I encourage anyone looking for information about their coverage options or assistance in enrolling to contact Aspen's Navigator program at 877-313-7215 or aspenhealthnavigator.org. Thank you. Director Falk.
Thank you, Kurt. My name is Kathleen Falk. I'm the Regional Director for the U.S. Department of Health and Human Services. And it is great to be here in Kokomo today. It is a cold but beautiful frost ice on all the trees day, so it is a joy to be here. I want to first thank the Comptroller Beach for pitch hitting for the mayor today. Mayor Goodnight has been so supportive of helping get the word out to people about this health insurance opportunity. He personally could not be here today, but he kindly asked the comptroller to serve in his stead, and I believe the comptroller is going to read a letter too that the mayor has sent in lieu of his being able to be here today. But I'm here to help to thank people for helping get the word out. A year ago, before the Affordable Care Act launched this first opportunity for people to enroll in affordable quality health insurance, there were so many millions of Americans who suffered without good health insurance and were so worried about the financial ruin that they might face without health insurance. We can stand here now a year later and know that 10 million fewer people lack health insurance. That is incredible. It's a dream come true for so many. But we also know that we have many more uninsured right here in the Kokomo area. And more surprisingly, that don't know about this open enrollment period. The surveys that we saw before the open enrollment period started showed that about 89% of the uninsured do not know there is this open enrollment period, and hence the importance of the comptroller and mayor and Kurt from Aspen joining here to help get the word out, because in 32 days, this open enrollment period ends. Now, what people will see when they come to the opportunity to this website, this marketplace to shop, that's different from the first year, are several important things. First, they will see a easier, simpler application process. From what was last year about an average of 76 screens that they would scroll through to enroll, there are now about 16, so it is a simpler process. They also do not need to create an account to log in to shop. They can look at plans without taking that kind of step. And third, for those who are coming back to the marketplace to see if there's an even better plan for them this year than last, they will find that their application is already about 90% pre-populated with the data they had already put in last year. So it's a simpler, easier application process this time. A second thing that people will see new is more choices and more plans, and that is a good thing. In Indiana last year, Hoosiers had 4 insurance companies providing plans. This year there are 9 insurance companies and offering plans. That's good for a lot of reasons. Not only will consumers have more choices of plans for them and their families, but the more competition means the greater pressure on prices, and that helps keep insurance rates lower. So that's good news. A third thing that applicants will see is that the plans are very affordable. In fact, for those going on the marketplace now to shop for insurance for 2015, 8 out of 10 will be able to buy this quality health insurance for $100 or less a month with the tax credits. So it is a very affordable. Fourth, it's really great health insurance. Everything from doctor's visits and hospitalizations to what's a requirement in the law for a no-cost preventative service. So if you were putting off that mammogram or that prostate cancer screening because you were so worried about not being able to afford it, this insurance requires a no-cost preventative service. So good quality, affordable price. Now, we also know that it is all working really well. In the first 5 weeks of the open enrollment period, over 6.5 million people have enrolled nationwide. In just the first month alone, about 89,000 Hoosiers enrolled. But we still have more people to reach. And so let me emphasize once again, there's only 32 days remaining. Thanks to leadership of the comptroller and the mayor and Aspen who are helping get the word out here. Now, there are two places where you can go to get assistance if you are wondering how to do this or where to get information. They are all free of charge. First, you can call the toll-free hotline of the federal government, 24 hours a day, 7 days a week. That number is 1-800-318-2596. Or you can go onto the website at healthcare.gov and find information there. But if you also want to talk to a real live human being and sit down or over the phone or in person, Kurt right here lives right in Kokomo, works for a wonderful statewide organization called Aspen. He has already provided the contact information for how to reach him, and he is very happy to make an appointment or to be a phone call away to answer any questions that anyone has. So thanks, Kurt, for all you and Aspen are doing. So with that, I'll turn it over to questions that you might have.
What were some of the most common issues people who had not able to complete the application process during last year's enrollment had? Were those issues addressed, as you mentioned, in this year's enrollment?
Yes, anytime you're doing something very large and new, that's challenging. As the president said, if this was easy, it would have been done a long time ago. But we all learned from that first open enrollment period and took those lessons to heart. And that is why some of these examples I gave of a simpler application process reflect what we learned and wanted to do to make it easier for people to learn. Because we know that a great number of the uninsured have never had health insurance. And so learning what copays are and deductibles, that's a whole learning process. Any other questions? If not, thank you for coming out on a cold and icy morning. I appreciate it.